Okay.
Yeah, I didn't have time to send you those slides we had for this one, but it was basically just about three little scenarios of couples that were funny that we, just unrealistic expectations.
Okay, don't
But
worry.
you can ask us and we'll tell you.
Okay, so we are live. I can see a green button. So, hello everybody and welcome to this epic live stream roundtable with Angie and Dr. Keith Nichols. Welcome, guys.
Thank you.
And if you haven't already, please subscribe by hitting that red button and the notification bell so you won't miss anything. And I also want to mention our closed and free Facebook group, TRT and Hormone Optimization Therapy, HOT, because if you're watching this, you surely must be interested. And if you haven't already, please join that group. The link you will also find under this video. So, okay, and let's get into the topic of today. And that's about the effects of optimizing your hormones on your relationship. So I've already heard a lot of people talking about that on different YouTube videos, in our Facebook group as well. A lot of guys have very opposing opinions on that. Some people say it causes anger and conflicts in relationships because sometimes the one partner does not agree with the other one that gets optimized, and others says that it brings nothing but benefits to their relationship. So what can you say about that as an opening, Keith or Angie?
Well, I would probably try to summarize. There are different scenarios that we can talk about, but if you're in a bad marriage, it doesn't make it better, right? If you're in a good marriage, it can make it better. And if so that those are two for sure right there. I mean, it's not going to save a marriage if you're not happy in your marriage by any means, but it certainly can make a good marriage even stronger and better. There are some instances where you can actually have a good marriage and only one does it, and that can create some conflict and issues, and that's what we'll get more into as we get into the podcast.
Okay. And what do you think? Because a lot of people say, I have that all the time in the comments on the channel as well. Oh, TRT, so testosterone, so that just makes you more angry, that changes your personality. And people are even talking about roid rage. So what can you say about testosterone and that part of the character?
Well, they've done studies on that, and doses that we utilize for medical TRT, I can't find any documented personality changes, anger issues with medical TRT, which is quite different from abusing testosterone or utilizing anabolic steroids.
Mm-hmm.
And actually, having low testosterone tends to make men more irritable. We see that with patients that are on androgen deprivation therapy for prostate cancer. So it causes depression, causes some irritability.
So it rather changes from depression to normal behavior than from normal behavior to aggression, for sure.
Absolutely.
Yeah, and the road rage, that's more something from the super physiological anabolic injecting bodybuilders.
Yes, absolutely. Always
Okay.
high dose, super high dose. I'm talking about 600 milligrams twice a week type of a dose, nothing that we would ever utilize.
Mm-hmm. And what about the personality changes? Because I'm sure, and I experience a lot of guys get more confident as well. That can, or they have more libido, of course, with TRT than on low testosterone. So that must bring personality changes and changes in the relationship as well, because I guess some men are getting more interested in women in general, maybe, and other women as well. So that can cause conflicts as well.
Well, it can. That goes into that issue that we talked about where one gets on it. And so if you're already in a bad marriage, it's just going to make that definitely worse. But let's say you're in a good marriage and one decides they're going to change their life and start their hormones. That can create some issues because if you lead a more sedentary lifestyle, your life is based around maybe going out to dinner and food and more sedentary activities. Once somebody starts, they've usually made a commitment to change their lives for the better, diet, exercise, And so when that happens, it can create conflicts, such as it can create some animosity by the other spouse. They can feel, it make them feel insecure. They're watching this person change in front of them with regard to their, you know, their attitudes, as well as their physical changes that they'll see. And it can create some animosity, some jealousy. Yes, you can have jealousy in a marriage. But once again, I think that especially when the men do it, the women can get quite insecure. And vice versa. We've seen women hate that the men were on it. That it changed a personality. As Angie said, when we're very symptomatic, if you're truly symptomatic from testosterone deficiency, yes, you're irritable, you're tired, you're fatigued, your interest in sex is not there. And once you get that back and it gives you your life back, in their eyes, you do change. But all you've done is gotten back what you were maybe in your 20s or 30s. And I can't say that you're going to feel like you were 20 or 30, but certainly the old self can come back as far as your personality and being outgoing and being happy and smiling and laughing and want to get out and enjoy life a little bit. So I do see that. We do see that. And that can be misinterpreted as a personality change.
Mm-hmm.
We always recommend if one person in a couple starts that the other join in too, because, it's all about balance and everybody should be on an even playing field and have the same level of energy, the same motivation, the same drive for different things. And it just makes it better when both people are on board, for sure.
Mm-hmm. And actually, how is the right way to go about this? Because I don't know, but I guess much more men are interested in getting optimized than women to start with. And isn't that the case that the men take their wife with them into the optimization thing, or is it vice versa?
Well, I'll let Angie answer that, but I'll tell you one quick reason is because, in women, it causes heart attacks, strokes, blood clots, and breast cancer. So the men will come in and get started on their testosterone, but women still have a fear that's a incorrect fear, but that's why a lot of them do not start. Are those fears, and it's exactly the opposite of what really occurs with hormone optimization, even in women.
But in our practice, we have an equal number of women as we do men. So we don't see a big discrepancy. And I guess it just depends on the population of people that you're talking about. But in our practice, it's about equal.
And do couples come in together, or is always one first and bring the other along afterwards?
It's kind of mixed. Sometimes we'll have them come in individually, and then within a 2 or 3 month period, the other person has seen the change, and it's usually a very positive change, and so they want to get on board. And but not always. Sometimes it creates problems too, and we spend a lot of time cautioning individuals about that when they come to see us, so that they kind of are prepared.
Mm-hmm. And after all this of an introduction, what is the right way to go about it actually? If one partner is interested in optimization, or maybe he goes to the doctor, to one of you, for example, and his partner is not really interested in it, or says, I don't have any problems, leave me alone, do your thing. So how to go about that?
One thing we have figured out and found out is do not force the spouse. Don't
try to convince them.
Yes, do not try to convince them they should do it. Let them see the changes in you, because they dig their heels in the sand, or if they do start, they're not fully invested, and they can be, they're just not happy. So they have to make up their mind on their own. I think that we see that quite a bit. Angie can probably touch on that a little more, but you can't. The men, when they come in and they get their lives back, they want to drag their wives in there, because the man's got his sex drive back. He's feeling well. He's active, and he wants his wife to be on board. But if she's not, it just creates problems.
Mm-hmm. And I think it's important. Men will ask me all the time, how can I convince my wife? And as Keith said, we never convince anybody of anything. We provide education. I think that is so important, is to give them the education and focus really on the long-term health benefits, as opposed to, muscle mass or sex drive or whatever. It's about, I want you to be around for a long time. I want you to be very healthy. I care about you. I want you to be here. And look at what all these positive things this can help us with. And if you approach it from that standpoint, you're going to get somebody that's going to be much more agreeable than if you're pushing in another direction.
Right. I mean, everybody comes in for the feel good now symptoms. I mean, they feel bad. They want to feel good now. But in the back of our minds, what we try to educate the people that come into the office or on telemedicine, I hope they can verify this, but we're trying to teach the long-term beneficial effects. And so that's the way to get a spouse in is to educate them and teach them about the benefits they're going to get 10, 20, 30 years down the road, not just the feel good now benefits.
Mm-hmm. Okay. And is there a difference? I know, Angie, we're going to talk about this in the next podcast about the women optimization, but is there a big difference between women before the menopause or after the menopause? Because I guess women are more interested in optimization after the menopause. Isn't that true?
I think it's a little bit of both, honestly, because it could be 10 years leading up to menopause that they start experiencing changes and a decline. And so they know that they need it. And it's much easier to manage somebody after menopause because prior to menopause, you're still having to factor in what the female body is creating on its own. And it can be erratic up and down. And so it's much more difficult to manage a perimenopausal or premenopausal woman than it is menopause for any day of the week.
Mm-hmm. Okay. I see we're getting in some questions in the chat box. For you viewers, we will attend to them after the discussion with Keith and Angie.
And so, one thing guaranteed is that every woman will need hormone replacement therapy, everyone, if they go through menopause, which if they live long enough to go through menopause. Not every man will get it or feel that he needs it, even though they would benefit from it, but every woman goes through endocrine failure. So it's the exact equivalent of us at 40 or 50 years of age being castrated, literally castrated. We would go to zero testosterone. They go to zero at menopause with regard to progesterone, the healthy estrogen, testosterone. So they live a truly miserable life, a lot of them afterwards, and they gain weight around the middle. And that's one of my areas that I enjoy researching on is the body composition changes that women go through in the perimenopausal and especially menopausal period. So it's really tough. Us guys don't have anything on the women when it comes to what they go through.
And when you bring that up about the body composition, that's one area where there can be some jealousy between men and women because the woman will see the man, oh my gosh, he's lost 15 pounds just within a month. Why can't I have those results? And with women, we go low and slow, and we're just more complicated. And it takes more time, and it is more difficult for us because of all these fluctuating hormone levels that we experience.
Mm-hmm. Do you ever get in couples that experience problems in their relationship because of the hormonal optimization of one of them, maybe?
No, not as a couple. When they come in as a couple, I can't think of anyone as a couple that started. When you come in as a couple, you're a committed couple. You're committed together. Like I said, if they're not forced in, if they come in on their own free will, that's a strong couple. That's a good marriage. That's looking out for each other.
They come in as a team. They have the same goal in mind.
So they do great. They literally, they do great. Angie's got some examples of what can happen if, you're in a bad marriage and someone starts, you have to go ahead and give those examples.
Which one?
The one that the family called you.
Oh, okay. So about a month ago, I had a lady call me. She had been married, I guess, about 35, 40 years. And the family had urged her to call me. She called me on a weekend. And she said, I've got to tell you something. She said, I've had an affair. And she said, my family wanted me to call and see, could it have been the hormones that caused me to do that? Well, we had about a 45-minute long conversation, if not longer, about the whole history of what led up to that. And, this was a woman that their whole married life, she had taken care of the children, she had taken care of the home, she had taken care of aging parents. The husband had a motorcycle. He was gone every weekend while she was at home taking care of everybody. So he was out for 35 years with all this freedom, and she had felt taken advantage of, I guess, used. She felt trapped, neglected there at home. And so once she decided to start doing some things for herself and she got optimized, she was feeling good. Her confidence came back, and somebody started paying attention to her, and he was gone as he had been for all those years. And that was really the cause of the affair. It wasn't her hormones that made her do it. It was 35 years of neglect that had led to that.
So once again, it leads back to, you've got a bad marriage, you've got a good marriage, and you've got a marriage where they're kind of coexisting. It's kind of good. It's okay. Everybody thinks it's okay. But if one starts, then that can pose a problem, as in that situation.
Okay, you maybe have seen the video I did with Dr. Jeffrey Rutterbush about the medical anosognosia, as he called it. So he said when the man maybe alone gets on TRT, the wife follows him and his character and personality very closely, and she blames everything he does on that testosterone. Do you have any experience with that?
Well, yeah, I mean, come on, a jerk before testosterone is going to be a jerk after testosterone, if that's his personality. But, I think that if we, really dissect a little bit further, is guys, it's not the women, but it's the guys, as they get on this testosterone and they have these body transformations, they're the ones doing the selfies in front of the gym mirrors and posting them everywhere. It's not the women. So these guys, get a little, I think probably get a little ego going, and it gets misinterpreted by the females. The guys, when they're in it, they are totally absorbed by it, a lot of them. And I think that they neglect the wife because they're so absorbed in their testosterone and working out. And so I'm sure the wife does feel neglected. It does feel there's been a personality change.
And does feel insecure because she's thinking, well, why is he so caught up in that now? Why is he? It must be somebody else that he's doing this for, because he hasn't done it all these years. Right. That's just.
But you can see the guys are more, when they get at that age group, in this middle age group, that when they make their body transformation, they're basically turning into a Kim Kardashian almost. I can guarantee there's going to be the weekly selfies of certain ones. But the women aren't so bad about that, really. They're not at all. They're just happy to
just want to feel better.
Just feel better.
Mm-hmm. Yes, but touching on that, I guess you are right. I don't know if is that your experience as well, but a lot of guys getting on testosterone are, of course, also interested in fitness, nutrition, optimizing their life as a whole, starting to work out again, maybe after a pause of getting fatter and more inactive. So is there a difference with the ladies there, Angie? I guess women are not much into the body culture thing.
Some women are. Some women are very focused on that, and but for the majority of women, no. But there are a few.
Well, as good as anybody, Stephen. It's skin, hair, and weight with women.
Yeah, exactly. Yeah. Oh, okay, but I don't know. Of course, we are in this closed Facebook group all about hormones, and a lot of men are in there, of course, and we're also talking fitness a little bit. But I don't know if that is your experience. Is the majority of men that get in your practice because of low testosterone, feeling depressed, feeling lack of energy? Are they into fitness as well, or is that just my impression? Because of course I am very much, that's my lifestyle, and then when you start to suffer low libido, then you do your research and you try to get optimized. But is the majority of men also like that, or is just are they just interested in golf or playing other things? I also imagine there must be two groups there.
There are the groups that come in that mindset are usually people that are a little on the younger side, 30s, late 20s, 30s, early 40s, that are more in tune to social media. So they're watching YouTube channels like yours or in Facebook groups. And so they are more in tune to working out and fitness. But we have this other population of men. And in fact, it's sad to me because we're not reaching that population of men. And that population of men are your average Joe, your blue collar worker, even white collar worker that go to work every day. They come home, take care of their families. They don't have the time that they would like to devote to exercise, but they feel miserable. They just want to feel better. But they're not on social media. They're not doing research on this. They don't even know what's wrong with them, most of them. So those are the ones I really feel sorry for, but those are the ones that get the most success when they do come in. When somehow they come in, which is usually word of mouth from one of their friends or, things like that, then they come in, you change their life. Those are the guys that say, you gave me my life back. And there's a lot of satisfaction out of getting those guys and making a significant change in them. But yeah, there's definitely two populations of men, especially men. Yes. So if you're not involved in social media, you don't have any of this knowledge. You're not going to get it from your family doctor or from the traditional medical system. So they're kind of odd men out. But I don't really know right now how to get to them other than maybe advertising, and they hear it on the radio because when they're driving. But otherwise, they're out there suffering and don't know that they don't have to.
Mm-hmm.
That population of men, they just want to, when they come in, they have grandchildren and they say, I want to be able to get out and play with my grandchildren. And as long as they can get out and do those things, then they're as happy as can be. And they will lose weight during that process. And, they get in a better state of fitness, but they're not as focused on.
Well, that's a good point. They will come in and say, I want to be a better husband. I want to be a better father. I want to be a better grandfather. I'm tired at work. I want to be more productive at work. It's not about the gym at all. It's not about the gym or how they look, if they've got a six pack or not. It's truly about, they just want a better life for them and their family. Mm-hmm. And like I said, it's very gratifying to give them that back. That's just very, you can't have enough phone calls in the day where that happens to men. It just, it makes your day every time I hear it or see it.
Mm-hmm. Maybe now is the moment to throw that question at you that I've already had in my mind for a few weeks. I've already asked several people, and I'll maybe do a video with Scott Howell. He agreed to do video on that as well. But I throw that question at you right now. The men that are on TRT, hormone optimization, and they are interested in the body culture thing and fitness like I am, are they more sensible to use that as a stone to use anabolic steroids?
Not my patient population, thank goodness. I don't have any, thank goodness. There's only one group of men that I won't treat as far as providing testosterone. Those are men that are going to do it purely for performance enhancement. We're a medical clinic. We're not even a TRT clinic. We're a preventive medicine clinic. Men and women. So, but I don't see it as a stepping stone in my patient population, thank goodness. But I do not see it. I mean, we've got a great population of patients, and that's not been an issue at all.
Okay, because as you might know, we're me and the moderators, Danny Bossa and so on, we are always trying to fight all the guys that try to get in our Facebook group just to get info on anabolic steroids.
Well, if you go to the various forums, they're out there. You know the ones that they are. I mean, the guys are using testosterone along with other substances, but that's the kind of forums that they are. It's really about bodybuilding and weightlifting and performance enhancement, and that's all great and fine. It's just, and I have no judgment there whatsoever. But it's not medical TRT. We just have to keep medical TRT purely medical TRT.
Because of the reputation of it, probably.
Absolutely.
And because what we're trying to promote is just the best quality of life, the best state of health for as long a period of time as we can. And we can do that, very well by just doing medical TRT. We don't have to do anything other than that.
Once again, Steve, we're focusing on the prevention of cancers and cardiovascular disease and
diabetes.
Osteoporosis, diabetes, obesity. I mean, we're really focused on the medical side, the medical prevention.
Exactly, but that's very difficult when you hear that from a doctor that has a body like me or like yours, maybe, Keith. Because when I try to start with, I have some men in the practice and they don't feel well, etc. And they come in for cool sculpting, and we do a long talk about dieting, working out, and so on. And we have a blood examination, and then they have a very low T. And then I start talking a bit about hormone optimization because, of of course, they never have heard of it, and they're not really interested in it. But then they look at me and they say, no, I'm not into things like that. So they always, so they mix that hormone optimization and TRT, of course, with anabolic steroids. And then they look at my arms and they think, well, he's injecting all kinds of wrong stuff. So I am a difficult one to talk to people about that.
We need to have you a T-shirt made. We had these T-shirts when I was wrestling in high school that, and especially, when you got in a certain amount of shape. But they said, no, I'm not on steroids. But on the back of the shirt, it said, but thanks for asking. So you just have a great physique and you're not on anabolic steroids. I know exactly what you're on and in the exact amounts. And you're just truly optimizing yourself, but you're maximizing what you've got to work with. Like I said, I give everybody the tools, but it's up to them to build a house. I can't build it for them. They've got to put the heavy lifting in. I just give them the tools. And so you've obviously absolutely maximized the tools you've been given.
Of course, there's much more to it than just the hormones. There's a lot of work and dieting and decades of persistent training, of course. But that's not something other guys see. Okay. Do you have any other stories that you wanted to tell us before we touch on some questions there? Patient stories?
Go ahead.
We had a doctor come in. This has been quite a while.
Dentist.
Yeah, quite a while ago. How many years ago? And so we always try to make sure we, understand what their expectation is so that they have realistic expectations when they come in and start. We don't want them to have any, false expectations. So I asked him, how can we help? What do you hope to achieve from starting hormone therapy? He said, I want you to fix my marriage. And then he went on
help me lose weight and fix my marriage.
Help me lose weight. And then the other one was, and to make my wife want to have sex with me again. And, of course, that's just unrealistic expectations that he had. But, they operated a practice together. They were both dentists. But that was the only thing they had in common was their practice.
So that's a good example of a bad marriage. What I talked about earlier, that it won't make a bad marriage better, make it worse. Well, what happened is, of course, he wouldn't put the work in to lose the weight. But his wife did come in as well to become a patient, and she did for a period of time. But she stopped once you got her optimized, especially with her thyroid. And she was used to sleeping for so many years in basically a onesie. I mean, just a pajamas, full-length pajamas. And once we got her, metabolism under control, thyroid optimized, it was too hot for her to do that at night. So she got a little angry that she wasn't able to. That was her protective barrier from her husband. So once again, they both started, but it didn't make the marriage any better because it was a bad marriage to begin with.
Mm-hmm. Yeah.
And another example was a radiologist came in and he wanted to be optimal, but his wife didn't want anything to do with it, didn't want him to have anything to do with it. And I just remember her coming in saying, it just makes me so angry in the morning to hear go click, 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 with this clicker too. And she goes, I hate that sound. She just didn't want him to regain any confidence. He liked to play basketball, liked to work out, but it got to where he was too fatigued and tired to do that. And she didn't want the change. She liked him where he was at home.
And that's a good point, because if you, really, we talked about this a lot. If you love your spouse and you should want them to be as healthy as they can be, to feel well, to function well, to have, vitality and enjoy life. And if your spouse isn't wanting that for you, then there's a problem there. Mm-hmm. So it's a little deeper than just being on hormone therapy.
I can't tell you the number of men that come in, and it's not so much the women, but the men that will come in and have a laundry list of how bad they feel. And they're easily improved with hormones, no doubt. And then when you tell them about it, and then that's what they're there for, their next question is, well, I'm going to have to ask my wife about this. So they'll go ask their wife. She's like, no, she didn't want me to. And I'm like, my next question then was like, I'm really sorry for that. I mean, I just can't imagine being in a marriage if my wife came to me and said, Keith, I feel fatigued. I have no energy. I don't want to do anything. I'm gaining weight. I'm not interested in sex. I would do anything I could to improve their life. So once again, bad marriage, it won't fix. You got to be supportive of your spouse.
Mhm.
But I do see men probably take it to the extreme. They become obsessed with it all, and that can probably upset many women.
But it can improve a good marriage.
Yes.
And we see that all the time. And they come back and both partners are just as happy as can be. And it's changed their life dramatically. So
Mhm. And how do you go about couples coming in? Do you take them apart? Do the wives go with Angie and the men go with Keith?
Initially, because one thing I did learn very early on, and I think rightly so, is I've never had a hot flash. My vagina's never been dry. So the point is that women know women. They want to talk to women. They're understanding of that. So how we approach a woman is, yes, I take them in, right? But when it comes to the women, Angie will meet with them, and once they've discussed what they really want to discuss and any sensitive issues, then I will come in and, of course, answer any further questions, go into any details about the literature or research. And so we try to give them a female to female alone time.
Mhm. I understand. Yeah.
I will argue that I do have a vagina, but it's not true.
Okay.
I was worried about this podcast. And I could keep him.
That is debatable.
Under
Yes, it's
control.
debatable what I've got down there. Yes.
Okay. Is there something about the optimizing of the hormones that is more important for a couple, especially? I mean, what hormone has to be optimized first in a couple? Is that always the testosterone for the man and the estrogen for the woman?
Women are so complicated. Men, testosterone, yes, absolutely. But then women,
Women, it can be
It's the board.
progesterone, it can be thyroid, it can be testosterone. It depends on where she is in her age, and, reproductive status. I mean, women are very complicated.
and you have to approach them individually. There are no such protocols like men. Oh, here's my testosterone protocol. There's no real protocol with women. Yes, if they're menopausal, we're going to start them on all these hormones, but it's different dosages for each one. They have different tolerances, So
we really have to take a real thorough inventory of their symptoms and knowing where to start and where to focus.
But as I have said before, the two feel-good hormones that really provide you with that energy and the things that they come in for, fatigue being the number one complaint for most people, but it's thyroid and testosterone.
Mhm. And of the 6 hormones that we sometimes talk about in men, being testosterone, pregnenolone, DHEA, melatonin, vitamin D, and thyroid, surely 4 of them must be the same dosages and everything the same as the women, except for the testosterone, maybe?
Only nothing really is.
Different dosages for melatonin as well, for thyroid?
Can be. I mean, we have one ER doc and she's on 200 milligrams, and some people only tolerate 1 or 2 milligrams. So
generally, women are more sensitive to melatonin than men, but we can't tolerate that high of a dose.
And
And
they
that's
get
for all hormones, really.
and they get a much less dose of DHEA. They're much more prone to break out than a man is on DHEA. Pregnenolone, we take the same dose. We supplement the exact same dose for men and women. It seems to be well tolerated. Thyroid can be very close when a man's on it. It can be similar dosages. Pregnenolone, but other than that, they're different. Melatonin, I just said that.
Okay.
But
That's
not
something,
testosterone. Of course, we don't take estrogen and progesterone.
of course, but I didn't realize women were more sensible for or sensitive for melatonin.
They can be. They can be. Some need more, but they tend to be a little bit.
Yeah, I mean, there are some outliers like the ER doctor he mentioned, but for the most part, the female melatonin is lower.
Yeah, and once again, I can't hit home melatonin enough for its anti-cancer properties. It's not just, it is a free radical scavenger, very important. And so we want to optimize all our hormones.
Mm-hmm. Okay, going to the questions in the chat box. Someone asked about DHEA. Do you think that for the women, 25 milligrams DHEA daily is a productive measure to attempt to increase libido before trying testosterone?
It depends. I mean, there's so much you have to consider whenever you start looking at DHEA in women. If it's a premenopausal woman, you have to make sure we always screen for PCOS, because women that have PCOS are going to have naturally high DHEA levels. So you would never want to give a woman like that DHEA. She's going to break out more. She's going to have more hair growth. It's not going to be a good thing. You have to. It's very difficult to just give a blanket statement when we're talking about women.
I don't see DHEA by itself. DHEA, if you look at the papers, in a man, it's really not converted to testosterone when you take it. In a woman, there can be some conversion, so it might help a little bit, but no different than men. Women, they don't need as much, but testosterone in and of itself is really what increases the libido and sex drive the most.
And if they're postmenopausal, maybe, for sure, estradiol.
Well, that's for vaginal, of course, those other complaints that women get, but sure, estradiol for vaginal dryness and atrophy.
Okay.
20 milligrams for a woman is a big dose.
Big dose.
That would be a big dose.
The men dose is 25, 50, or 75, basically. I don't really have anybody that I know over that right now. But not many. It's usually 50 milligrams on average.
Okay.
Per man.
For men.
Someone asked, have you met with a situation where testosterone deepened depression, Keith?
No, I haven't seen that. I'll say this all the time, and I really worry about it, especially in the younger population of men in their late 20s, early 30s. In regular medicine, in the traditional medicine, men are being treated, as women are being treated with antidepressants for testosterone deficiency. All right, instead of treating testosterone for the deficiency, and those men will get better if their depression is due to the testosterone deficiency or the hormone deficiency. Some of the problems that I run into now is that men that are on forums, especially the younger ones, it's typically younger guys, like I said, 30s and young 30s, late 20s, but they're really social media savvy, and they've done all their research and studies. And so when they start looking up the symptoms of testosterone deficiency and they start typing in their symptoms or looking at it's got to be testosterone. The problem is that when you get some of those men an optimal range, some of them are not better, because their depression was depression. I mean, they have some underlying anxiety or depression, maybe a bipolar disorder. I mean, unfortunately, we do have, mental illness there. We can all suffer from anxiety. I do. But nonetheless, it won't fix what it's not related to. It really won't. No matter what anybody says, you can't just throw testosterone to somebody that's truly clinically depressed or, has a predisposition or genetic to be depressed. They're going to stay depressed until that's treated, until they get help. And so, but they typically throw all their eggs into the testosterone basket, and that's not going to fix it. So, as I say all the time, hormones don't cause everything, and giving you hormones don't fix everything.
Okay. Do couples ever get referred to you by a relation therapist, for example, that says, how you can't get out of these troubles in your relationship, something must be wrong with your hormones?
We haven't seen it with a relationship or marriage counselors or anything like that, but psychologists, we have several that will refer to us.
And
thyroid is so important, especially in women. I mean, women need that thyroid so much more than men, and it certainly can cause some mood disorders and problems if they're not optimal in their thyroid. But of course, they go to their doctor and they're maybe in the lower end of range normal, and it's still normal, so they're denied treatment.
Mm-hmm. I know we are later going to do some live streams with questions on the female optimization, but someone asks, if a woman has a family history of stroke, would that be a reason to go with an estradiol patch instead of a pill?
If it was, and you'll say, if it's me, her, my mother, my grandmother, whoever, they're going to get oral estradiol, all right? But the forever safe way to get estrogen is transdermally, whether it be a patch or a cream. Nobody's ever going to argue that. So if they have another stroke, automatically wasn't from that. The problem is that oral estradiol in and of itself, in any study, has never caused that. But of course, it was Premarin, and women less than 60 or greater than 10 years out of menopause, never estradiol. So the family physicians don't know that. They don't really know the details of the Women's Health Initiative. and they don't realize it was Premarin, and it was in women with pre-established plaque. And Angie went over that in a previous podcast with you. So it will get blamed on estradiol, though. It will get blamed on it. So the safe thing to do in that person would be to put them on transdermal. They will get all the benefits of estrogen, except they won't get all the cardiovascular protection that you could get, because the oral will give you better cardiovascular protection. So yeah, I mean, so the doctor would probably put them on transdermal or patch just to prevent being accused of causing that next stroke or that next blood clot. But has estradiol ever caused that? No.
Okay. I see just one more question coming in. Does oral pregnenolone increase progesterone in men?
I don't measure progesterone in a man. Don't need to. Never need to.
That's not a hormone that we should be interested in.
Nope, not a hormone we should be interested in.
It can't cause any troubles when it's too low or too high. Okay. So it's
not really a male hormone. I mean, it may have just a speckle in there, but it's not really a male hormone that needs to be addressed.
okay, so we shouldn't worry about that.
You do want to optimize your pregnenolone. I mean, it's a memory enhancer, it has its benefits. But we don't measure progesterone, so I've never seen a clinical reason why.
Okay.
A clinical paper on anybody measuring it.
For men.
For men.
I see a practical question for you. Dr. Keith, do you have patients from Canada, and how do you manage them?
I do. They'll come down, and they can take a 6-month supply back with them. So they might come down twice a year, or they may have a residence that they have across the line, and so in the United States. And so, a lot of farms can ship to an address. They can't ship to P.O. Box. They can ship to an address. If there's somewhere they live, or a family there, then it can be shipped to them at their family's home. So yes, we do have Canadian patients, but a lot will come down here in person, leave with a 6-month supply, or they will stay at their families or a house in the U.S. and get their prescriptions that way. But you can get up to a 6-month supply at a time.
Okay. Before we end this live stream, is there anything more you wanted to say about the effect of hormonal optimization and relationships?
No, I think, Keith just drove home the point really well, that it's not going to make a bad relationship better, but it can make a good relationship better. But you have to, evaluate it, and it's not hormone therapy's fault. If there are problems, that's between the two individuals.
Like I said, you could have a good, decent enough marriage, but if one starts, it can create some issues. Once again, with the insecurity or the jealousy or the, even some animosity, that they're changing and they're becoming more active. And of course, they don't feel like it. They want to continue to live like they're living. They don't want to become more active because they don't feel like it.
We had one lady that said one time, she was like, I just want to sit on the couch and grow old and not do anything.
Remember that. That's right.
I mean, this was a fairly young lady that was saying this, but, people are resistant to change oftentimes.
That's true. That's true.
We get a lot of thank yous from the viewers in the chat box. They think it's an awesome podcast. Thank you, guys. You guys rock. Thank you. So a lot of thanks.
Thank you.
Okay, so all that rests for me is to thank you as well. And maybe you can tell viewers one more time how they can work with you, how they can find you.
They can reach us by contacting us through our website. Yes, thank you. At tier1hw.com. They can also contact our office, and the number is 423-417-1700. Emily will be happy to help anybody that calls, and we'll do everything that we can to get them on the right path.